Well, hello there. I'm Dr. Srinidhi Bhatt, your neighborhood pediatric dentist. Today we are here to talk about your kids' oral hygiene. Well, you think you're busy? Have a look at your kid once. In addition to school, activities and family time, they're learning how to take care of themselves and others in new ways every single day. One of the necessary life skills a child needs to learn is brushing his or her teeth. Several studies have suggested and pointed out that kids love cleaning their room with parents, packing their backpacks for school, and getting dressed for the morning. However, when it comes to dental routine, most of them spend less than just 2 minutes, that too on scrubbing the surface of the teeth. Surprisingly, research suggests that besides kids, even some adults spend less than 2 minutes on brushing their teeth. To prevent cavities, you need to remove plaque, the transparent layer of bacteria that coats on the tooth structures. So how can we remove the plaque? We can remove this plaque by using a toothpaste, a toothbrush, oral irrigation devices, or flossing, or even mouthwashes and interdental cleaning aids. Oral hygiene practices is essential for everyone, and it should begin with the first tooth of your child on daily basis. The best way to do this is by helping your child get into the habit of brushing twice a day for 2 minutes, and that's no small feat. But a little creativity can go a long way when it comes to his or her long-time dental health. As by not doing so, it can directly cause the toothache, gum issues, single or the whole dentition undergoing disintegration, or indirectly cause social rejection or psychological issues due to the visible defects of the teeth and malalignment or bad oral odor. So how should you start brushing your baby's teeth is what would you ask? It all starts by cleaning baby's very first teeth, the front of the tongue, and gums with a soft damp cloth, a gauze pad, or even a soft rubber or silicone finger brush. They are both gentle options with a nubby texture babies tend to love. This should be done both after meals and at bedtime. Toothbrushes can be moistened with water without toothpaste. Doing so helps fight bacterial growth and promotes good oral health long before baby's first teeth start to appear. Even before your baby starts teething, run a clean, damp washcloth over the gums to clean away harmful bacteria. This removes plaque and also massages the gums, relieving teething pains. For toddlers and preschoolers, kids at this age usually don't have the control or concentration to brush their teeth all by their own. So we recommend parents to supervise and help their kids in brushing their tooth so that they can remove the plaque which actually causes the dental decay in them. As you might guess it right, the number one dental problem among preschoolers is tooth decay or tooth cavity. It's a good idea to tackle brushing in the following order, where you start with the chewing surface, then outer surface, and finally the inner surfaces. Cleaning the chewing surface is the first priority for toddlers, as this is where they are most likely to develop fissure cavities. Well, fissures are the grooves which are present on the biting surface of the molar teeth, and food usually gets left behind here. A toddler's toothbrush usually have a small head and a large handle, and they usually have a soft grip also, so that the tender hands, the soft hands of baby doesn't find it difficult and they find it easy to hold this handle and brush the teeth. It is best if you put the toothpaste on the toothbrush until your child is about age 3. Until children are 8 or 9 years old, you need to help them brush. Try brushing their teeth first and let them finish. The brush size I usually prefer to kids of age till 6 years is a small size, which is about 15 to 19 mm diameter, and from the age of 7 to adulthood, the regular adult sized ones, which is about 22 to 25 mm diameter, with the bristles always being ultra soft. For kids about 1 to 2 years of age, A small rice grain size of non-fluoridated toothpaste is recommended as the child hasn't developed the adult swallowing reflex yet. The other best way is dipping the brush without toothpaste in a diluted mouthwash and then brushing their teeth. For kids of about 2 to 3 years of age, again a rice grain size of fluoridated toothpaste to provide essential minerals during tooth formation stage. For 2 to 3 years, remember, it is fluoridated. Below 2 years, it is non-fluoridated. And around 2 years of age, your child should learn to spit while brushing. Avoid giving your child water to swish and spit because this can make them swallow the toothpaste more. Toothpaste should be pressed onto the front 2 rows of the bristles of the tooth. Children in the age group of 3 to 6 years can use half a pea size of the fluoridated toothpaste. Again, smeared on the brush though. Kids in the age of 6 to teenage, they would need a regular pea-sized toothpaste and no need of smearing the paste into the brush as they have a well-developed swallow pattern and they can spit their paste well. In case of teenagers, they really don't like interferences, especially these days, and most of them would appreciate a good amount of independence. In such kids, one of the best solutions that we have found out is giving them an electric toothbrush with a timer. So now we know which brush and quantity of toothpaste, but now let's learn how to brush.
Now get your toothbrush ready and follow me. Okay, we have 2 minutes. Get ready. Let's make some circles, 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 circles. Circles on all sides of your teeth.
So ways to make brushing fun for kids, possibly have 4 minutes of fun. Just don't set a timer and supervise. Instead, make brushing twice a day for 2 minutes as an event. By possibly cranking up your child's favorite song and having a 2-minute dance party. Or videos of brushing apps may also make the time fly by, especially in younger brushers, they would love it. Try reading a 2-minute story using all your best voices. Whatever you do, get creative and switch things so that brushing time is always a good time. Start a routine and stick to it. You may be tempted to let your child skip brushing after a long day or during the times when your normal schedule is off, like when you're out for a vacation. But keep at it. The more second nature brushing becomes, the easier it will be to make sure your child is brushing twice a day for 2 minutes. Reward good brushing behavior. What motivates your child? If it's stickers, make a reward chart and let him add 1 every time he brushes. If he's a good reader, let him pick out the bedtime story. Maybe it's as simple as asking to see that a healthy smile, saying that I'm so proud of you, and following up with a huge high five. Characters count. Who is the character your child can't get enough of? Especially like Chota Bheem or Doraemon or Little Singam or someone like that. Especially that Peppa Pig one, which I recommended to a lot of kids. Watch and read them together. So when it's time to brush, you can use that character as a good example. If none of these work, make up a story. Haven't found a story or character to inspire your child? Make up your own. Your child just might be the only superhero who can brush away the bad guys that causes cavities. Go shopping. Let your child pick out his favorite toothbrush and toothpaste. We usually recommend the ones which are specified for kids. Choosing a character toothbrush might make brushing more fun, and fluoridated toothpaste comes in a variety of flavors and colors which are ADA recommended also. Make brushing a family affair. Your children learn from you. So set a good example. The family that brushes together has even more reasons to smile. Well, in the recent past, we had this viral trend of flossing. Not this flossing. Well, you guessed it right. It is the dental flossing. So everyone wants everything to be 100% thing, correct? You want everything to be perfect, 100% perfect. So if you only brush your teeth and don't floss, consider your teeth only 60% clean, not 100%. Remaining 40% will only go if you floss well. Well, you'll ask me what is the best method of flossing and which is the best floss. Well, that's an absolute personal choice. Which is the best one for you and your kid, that's an absolute personal choice. But I usually prescribe my patients a waxed dental floss with handle. They usually come in multiple shapes and sizes, so it's an absolute personal choice. I would want you to have a word with your dentist and he can recommend you the best one. Now coming to the flossing proper method. The proper method of flossing is by taking a floss of about 18-inch length and tying it around your middle fingers of both hands to form a firm grip. Pinch the floss between thumb and index finger, leaving about 1 to 2 inch length in between. Use thumbs of both your hands to direct floss between upper teeth and index fingers to floss between the lower teeth. Gently pass the floss between the teeth with a zigzag motion and do not force the floss with a snag in between the teeth. Instead, adapt it to the teeth and counter floss it against the tooth surface. Floss each tooth surface thoroughly with a clean section of the floss. The easier method is using a handled floss. Well, a lot of my patients ask me, sir, can we use a mouthwash on a regular basis? Well, you can use a mouthwash every once in a while, but I don't recommend to use a mouthwash on a regular basis because they kill the good bacteria in your mouth too. But as the mouthwash is not palatable, I prefer to dilute it to my patients and they can make it a happy dance routine of using the mouthwash. So, take a small diluted amount of the mouthwash in the dispenser and start swishing. Swish, swish. Do this to at least 30 seconds. So, chop chop. Get your oral hygiene kits ready and give your oral cavity the spa experience it deserves. Thank you.